Hello everyone, this is Dr. Khosroabadi with another episode of Fix My Foot. Today we're going to be talking about the major differences in the surgical approach between the traditional bunion surgery and advanced minimally invasive bunion procedure. Alright, hi, this is Dr. Khosroabadi and we're trying to create some videos comparing the traditional bunion surgery to minimally invasive bunion surgery, more specifically advanced minimally invasive bunion procedure. I've had a lot of patients contacting me and asking me what's the difference, and I've also had a lot of patients who have been going to other foot surgeons or podiatrists, and they were told that they're getting minimally invasive bunion procedure where in actuality they were not. They were just getting a traditional bunion surgery with a smaller incision. So first comes first, let's clarify what qualifies a minimally invasive procedure. It could be a bunion procedure or any kind of orthopedic or plastic or any kind of surgery. In my opinion, minimally invasive procedures are procedures that are performed through a very tiny incision. We're talking about 1 centimeter or less. If you've had any surgeries in the past and you had an incision that's larger than 1.5 centimeter, then most likely you did not get a minimally invasive procedure. Let's say you got a knee scope. You had 3 small holes that were closed with 1 stitch. We call that a minimally invasive procedure. So when it comes to bunion procedures, any procedure that's performed and the incision is smaller than 1 to 1.5 centimeter, I consider that a minimally invasive bunion procedure. How invasive the procedure is, meaning was the skin completely open and the dissection was done to get to the appropriate area, in this case the bone, or was the procedure completely done under a visualization help, such as a fluoroscopy, which is live x-ray, or a camera. We're not using camera in bone surgery, but in bunion procedure or bone surgery, most often, I would say 95% of the time, we are using fluoroscopy, which is live x-ray. So that's exactly how I perform my procedure. The entire procedure is performed under fluoroscopy, meaning that I am not looking at the foot, I'm not looking at the incision that I made, even though I made a small incision. I am introducing my instruments, whether it would be a very small saw or an osteotome or a burr, but then the rest of the procedure, I am looking at the camera, meaning the live x-ray, to perform my procedure. So in that sense, that is a true definition of a minimally invasive procedure, meaning you're not opening anything up, you're not invading the soft tissue, you're not invading any of the structures around the bone, such as nerves, arteries, veins, tendons. These structures remain intact and the procedure is performed. That is what qualifies a minimally invasive procedure. The fact that you're not invading any of these structures is important. The reason that's important is that the recovery would be a lot quicker. When you're not invading any of the skin, soft tissue, veins, arteries, tendons, they recover a lot quicker because you did not cut through them, you did not invade them, you did not dissect them, so they quickly heal. At the same time, they are also providing stability, meaning if you did not dissect off of any of these, off of the bone, any of these structures, the bone stays more stable. So your fixation has to be less robust, if you want to call it. Soft tissue provides a lot of stability to the bone. So therefore, when you're not invading the soft tissue, you still have more stability. At the same time, you have less pain, less swelling, and faster recovery. So those are the 3 or 4 different benefits that you get from minimally invasive bunion procedure. Again, that would be less swelling, less pain, faster recovery, and that could mean faster recovery with the soft tissue and faster recovery with the bone. So those are the main points that I wanted to make performing a minimally invasive bunion procedure.